Your supervisor asks you to observe the client and determine what skills are currently in their repertoire. What does your supervisor mean with this request? So what is your supervisor asking you to do? The key word here is repertoire, okay? What do they want you to look at when we're looking at a repertoire? So if you've never heard that word, if you're unfamiliar with that word, it's okay. A lot of RBTs are. When we talk about a repertoire, we just mean a set of something. So if you have a repertoire of skills, that's just going to be your set of skills, right? If you have a repertoire of self-stimulatory behavior, that's going to be the set of self-stimulatory behaviors that you engage in. So if your supervisor is asking you to observe the client, determine the skills in the repertoire, they're simply asking you to determine what skills the client already possesses. So that's what we're looking for. So A, they want you to determine how well the client communicates. A would be okay if the question was, your supervisor asks you to determine what's in your communication repertoire, okay? We're just talking about general skills here. So A is okay, but we want a better answer, right? B, they want you to determine what skills the client currently possesses. Absolutely, that's what we're looking for, right? The skills the client currently possesses, that's the repertoire. Always read all of your answer choices. C, they want you to determine reinforcers for the client. You can have a reinforcer repertoire, right? All the reinforcers that work for you, but we're not looking at that. We're looking at the skill repertoire. And then D, they want you to determine how often the client engages in maladaptive behavior. That would be some sort of frequency measure. We are not measuring that. You're simply working with the client, observing the client, figuring out what they can and can't do. You're identifying their repertoire. So our answer here is B. You need to determine what skills the client currently possesses. Your client has trouble with their fine motor skills. After 3 months of practice, they are unable to feed themselves with a large blue spoon. They are able to feed themselves with a large blue spoon. However, the client is unable to feed themselves with other spoons or utensils. What is your client lacking? Okay, so you've taught your client, the client has learned to feed themselves with this single large blue spoon. You're very excited. You want to tell your supervisor, you want to tell the client's parents, but when you go into the kitchen and you hand them a silver spoon, they can't use it. What is the issue? This is not uncommon, okay? It happens with utensils, with writing utensils, straws, different clothes, okay? We teach a skill using one stimulus and then we can't do it with other stimulus. What is that called? Is this maintenance? No, maintenance would be if they were unable to feed themselves with the large blue spoon. Maintenance has to do with what skill you taught, and then can that skill maintain after teaching's over. So if they're able to feed themselves with a large blue spoon, that skill has maintained. It just hasn't what? It hasn't generalized, right? It hasn't generalized across multiple stimuli, okay? We need that feeding response to work with a large blue spoon, a small silver spoon, a medium green spoon. We need to generalize across utensils. So our client is lacking generalization. What about C, motivation? There's nothing implying that there's no motivation to feed themselves, obviously, because they have to feed themselves. They're able to do it already with the large blue spoon. And then desire. Desire would never be the answer, okay? Because that's a mental state, right? And we don't measure mental states. We don't say the client lacks desire because we can't measure that and we can't observe that. Simply, your client is lacking the ability to generalize the feeding skill to other spoons and utensils. Tommy loves cooking dinner for his wife. He always tries to have it ready for her when she gets home. Tommy will often forget to turn on the oven when he is done cooking. His wife decided she will start providing Tommy with his favorite type of cookie when he turns the oven off without a prompt, but she will withhold the cookie if he leaves the oven on. What type of intervention is Tommy's wife implementing? Okay, if you're new to studying, this is a differential reinforcement question, which can be tricky. If you've been studying a while with my materials, you should have immediately recognized this type of question as a differential reinforcement question. okay? All differential reinforcement questions kind of follow the same pattern, right? We're reinforcing behavior or a lack of behavior, okay? Putting other things on extinction, right? And then we have to determine what type of DR intervention we're using, okay? So what is our checklist? We look at DRO and we ask ourselves, is Tommy being reinforced for doing a behavior or not doing a behavior? If Tommy is reinforced for not doing a behavior, okay, that's a DRO. So let's see. Tommy with his favorite type of cookie. His wife decided she will start providing Tommy with his favorite type of cookie when he turns the oven off without a prompt. So when Tommy does a behavior, he gets reinforced. It can't be DRO. DRO is the absence of behavior. So let's look at DRA and DRI because we're teaching obviously a replacement behavior. Extinction is leaving the oven on. Reinforcement is turning the oven off. Can you leave the oven on and turn the oven off at the same time? Are those compatible? No. So this has to be a DRI. That is our checklist, right? Are you reinforced for doing a behavior or not? And then if it's reinforced for doing a behavior, is that behavior compatible with the alternative? If it is, it's DRA. If it's not, it's DRI. Okay, so our answer here is DRI. Tommy is going to be reinforced for turning the oven off, which is the replacement behavior for leaving the oven off on. You can't have the oven off and on at the same time. Those behaviors are incompatible. Therefore, Tommy's wife is using a DRI. Which of the following basic reinforcement schedules calls for the delivery of reinforcement for a certain number of responses? Very simple, straightforward question, okay? This is a type of question. Once you're good at the test, you can answer 10, 15 seconds max, right? We're just asking to define basically your reinforcement schedule. So what reinforcement schedule calls for the delivery of reinforcement for responses? Well, you know you're dealing with responses, right? So we can eliminate intervals, B and D are gone. So now we just need to determine, are our responses fixed or are our responses variable? Well, it says a certain number of responses, right? So we can assume it's fixed. So our answer here is A, fixed ratio reinforcement schedule. Super easy question, okay? If this question was difficult, go back and brush up on your basic reinforcement schedules. You should have no trouble answering this question. Rachel was using SAFMEDS to study for her RBT exam. Her target is 10 flashcards correct per minute. Today, her data indicated she did 4 minutes, 6 minutes, or 4 per minute, 6 per minute, 8 per minute, and 2 per minute. What is Amy's average rate for flashcards correct? Okay, first SAFMEDS, right? Say all fast, minute every day study. Basically, it's a flashcard system where you're trying to do as many flashcards as possible within a minute. Fantastic way to study. I recommend it, okay? But what is our question asking? Our question is asking about the average rate for flashcards correct. What is rate? Rate is frequency over time. So we need our frequency and then our time component, okay? And then we're looking for the average. How do we find an average? Well, to find an average, you add up all of your data and then you divide it by the total number of trials or intervals or data points, okay? So we have 4 data points, 4 per minute, 6 per minute, 8 per minute, 2 per minute. We need to find average rate. So let's add up 4 plus 6, which is 10, 10 plus 8, which is 18, 18 plus 2 is 20. That's our total frequency. Divide that by 4, okay, what do we get? We get 5. We get 5 per minute. Look how simple that is, right? You simply add up all your rates and divide it by 4. That's how you get an average, okay? On the exam, you might have to conduct, okay, an average math problem. But this is how simple it is, right? If you can do an average, you can do this problem. This should not be a hard problem either, right? They give you all the data. You're simply adding it up and dividing it and finding the average. So Amy's average rate for flashcards correct is 5 per minute. Session notes are an integral part of service delivery. Proper session notes should include all of the following except what? So session notes are a requirement of all RBTs. No matter what company you work for, you will have to produce session notes. Session notes let supervisors know what happened during session. Session notes are a good way to check the history of sessions. Session notes let other RBTs know what happened during session. So session notes should be written properly, and they're important. Okay, so we need to take them seriously. So what are some of our keys for session notes? They need to be complete. They need to be clear. They need to be objective. Okay, so this question is asking what should be included in a session note? All of these except what? So 3 of these should be included and 1 shouldn't. A, what you observed during session. Definitely, right? What you observed is very important during session. That's going to give us a picture of what happened. It needs to be objective, right? So you just need to write what you saw and nothing else, okay? But A is important. What about B? What you measured during session? Absolutely. What behaviors did you track? What skills did you track? How did you track them? What was the outcome? Okay. Now, session notes, you only want to include the most important things. It's not like you're going to be writing a paper on your session, okay? But a general idea of what you observed and what you measured, A and B definitely are included. What about C? Your subjective opinion of session. Do we want your subjective opinion? What is subjective opinion? That is what you think happened from your perspective, okay? Not what you observed, but how you felt about it, right? Your interpretation. It's not really what we're looking for in session notes, okay? Subjectivity has no place in session notes. We don't want to hear about why I felt, okay, or I thought, or I feel, okay? That's for conversations with your supervisor. Session notes should be very straightforward, very objective. So C is a very good answer. Let's read D. Anything that was mastered? Yeah, if you mastered out a skill, okay, that'd be great to know. That way we can move on from that skill. But proper session notes should not include any subjective opinion of session. Objective, measurable, right, complete. You are working as an RBT in your client's school. You are assigned to assist with managing your client's behaviors during math and reading class. Your BCBA instructed you to put vocal self-stimulatory behavior on extinction, but your client's teacher asked you to redirect the behavior. How should you proceed? Okay, tough situation, right? This situation could occur in home as well. If you are implementing a plan and your client's parents tell you, no, I think we should do it this way. Difficult situation for an RBT because you aren't allowed to change the treatment plan, right? So how are you going to react? You're in the teacher's classroom. You understand what you should be doing. You know the plan, but they ask you to do something different. What do you do? A, comply with the teacher since it is her classroom. So this is a tough spot, right? Because if you comply with her, you're technically doing the behavior plan wrong, right? So immediately complying with her and throwing the behavior plan out the window isn't necessarily the right thing to do. Now, if this happens, your BCBA kind of put you in a bad spot. They should have had this conversation with the teacher before and explained the situation, okay? But throwing the behavior plan out the window isn't exactly what you want to be doing. B, explain to the teacher that you must follow your treatment plan and proceed as directed by your BCBA. Okay, not bad, right? You want to follow your treatment plan and you want to do what your BCBA says. So B is okay. It's a little over the line for an RBT, right? Because it's not really your place to explain this to the teacher, okay? And it shouldn't be your responsibility. But B is an okay answer if we don't have a better answer. So let's read C. Explain to the teacher what the treatment plan says and inform them you will consult with your supervisor on how to proceed. Yes, right? This is giving an explanation for why you're engaging in this behavior or why you're treating the behavior the way you are. And then you're also saying, I'm going to consult with my supervisor on what to do next, okay? That might be having the supervisor call the teacher, That might be adjusting the plan. Whatever it is, C is the best because it's got the most communication, right? It's collaboration. We should be collaborating with other people with the client's interest in mind. Okay, so C is stronger than B. C is better than B. And then D, report the teacher to her principal. No, I mean, the teacher's just doing her job, right? That's just going to cause more issues. All right. Remember, what does our task list say? Our task list says seek supervision when necessary, communicate in a timely manner, okay, and collaborate. C has all of those, right? You're collaborating, you're communicating, and you're seeking out training and information in a timely manner. C is better than B, so C is how you should proceed. Kind of a tricky ethics question, okay? So if you got it right, good for you, right? Kind of a challenging one. Sue is learning to play her favorite Chopin piece on the piano. Each time she successfully plays a part of the song correctly, she asks her girlfriend to reward her with a glass of wine. Sue slowly increases the length she is required to play for a reward until she is only rewarded for playing the entire song. What best describes what Sue is doing? All right, so what kind of intervention is Sue doing? Let's say Chopin has five parts. Sue plays the first part, is reinforced. She then says, okay, I'm only reinforced when I play part 1 and 2, and then 1, 2, 3, and then 1, 2, 3, 4, and then 1, 2, 3, 4, 5, and then only reinforced when she does the full song. So Sue is working up to this final terminal behavior through what? Through successive approximations of that behavior, which is the song. What does that describe? What are successive approximations, and when do we use them? Successive approximations are parts of a behavior. They're pieces to the behavior that we slowly build up. So what is that? There's a very specific term for that. Is it functional communication training? Is it shaping? Is it extinction? Or is it generalization training? Well, it's definitely not extinction because Sue is getting reinforced. It's not generalization training because Sue is not generalizing this piece to any different piano or different environment. It's not functional communication because Sue's not learning to communicate, okay, in any way. So it has to be B, shaping. So you could have answered that question 2 ways. You could have eliminated A, C, and D and been left with B, or you could have just realized, like we said, she's using successive approximations to teach a behavior, and that is exactly the definition of B, shaping. That's why when you're studying, it's good to figure out why the wrong answers are wrong. That's going to help you down the line eliminate those answers, okay, if you're struggling with the question. Understand why A, C, and D aren't the right answers. That's going to make you better, at the test. RBT should maintain respect for the client and ensure their dignity. Which of the following answer choices would be the best way to do this? All right, how are we going to ensure our client's dignity? How will we ensure they have respect? No matter the disability, no matter the competency, no matter the ability, we have to ensure we respect them and that they're dignified. That's their right as humans, okay? Ethically, it's our responsibility. So which of the following answer choices will be the best way to ensure dignity? A, respect cultural differences your client's family may have from your own. Yes, right? We have to do that. That's very important. People view disabilities, they view ABA, they view all of these things in different lights. When you go into homes, they have their own customs. It's your job to respect those. It's not your job to judge those. So ensuring dignity is respecting cultural differences. A is a good answer. Always read all your answer choices. Maybe there's a better answer. B, adhere to house rules that your client's parents have in place. Taking shoes off, etc. Absolutely. If your client wants you to wear a mask, gotta wear a mask. If your client wants you to wash your hands, gotta wash your hands. If your client wants you to take your shoes off, take your shoes off, right? If your client wants you to work in the living room, respect that. If there's any issue, what should you do? Communicate to your supervisor. But you really should adhere to their rules, respect that you're in their home. So A and B are both good answers, right? What about C? Provide the client with privacy that is adequate for their age and need. Absolutely. You should not be violating any sort of privacy rights for the client. Just because maybe you're helping them with toileting, maybe you're changing diapers, maybe you're helping them get dressed or teach them to dress themselves. Regardless, a same amount of privacy that you would want should be allowed to them. So A, B, and C are all good. That leaves us with D, all the above. So 2 reasons why you should always read all the answer choices. 1, because you're looking for the best answer, not a good answer. And 2, situations like this where you have an all the above question, none of the above question, right? Always be sure, always read all the answer choices. What differential reinforcement procedure would be used if the most important thing for the intervention is providing as much reinforcement in the absence of the behavior as possible? Okay, we talked about it earlier. When you saw that word absence, you should immediately know what we're talking about. When do we provide reinforcement in the absence of behavior? What DR plan? Well, what's our checklist? DRO. Is the behavior, is the learner being reinforced for not engaging in a behavior? In this case, in this situation, they are. So A, DRO is providing reinforcement in the absence of behavior. If your behavior is screaming, if we're implementing a DRO plan, anytime the client doesn't scream, we'll reinforce. DRA, DRI, okay, those are not, right? You don't really need to be familiar with DRL for the RBT exam, okay? It's a time-based deal. So what intervention is used for providing reinforcement in the absence of the behavior? A, DRO. All right, I hope you enjoyed that. Thank you for watching. Welcome to the channel or welcome back. Please like and subscribe. It's a big help to me. If you need our study materials, rbtexamreview.com. Other than that, any questions, please email me, leave them below. Study hard, and I'll see you soon.